Welcome to another episode of the Liberty Mastermind podcast. I'm Ox, along with my good buddies Pat and Jack. Today we're going to be talking with Dr. Jason M., who is a doctor of pharmacy. He is going to be giving us some behind-the-scenes information that even I didn't know about, and I see patients every day. So what we're going to talk about with Jason is what do pharmacists really do? We kind of see them buzzing around in the retail pharmacy stores, and they're counting stuff and handing out medications. But what do they really do? What are the different jobs pharmacists go into after earning their doctor of pharmacy? And an analogy: pharmacists are like book editors. What?
Can't
Questions
wait.
you can ask. What?
Can't wait.
Questions you can ask your pharmacist. The problem with getting your medications from different pharmacies at the same time. How about some money-saving medication tips with what's called a home medication reconciliation? What's the benefit of visiting a compounding pharmacy? And lastly, medication lollipops. What the heck is that?
Here we go.
Right. So before we get rolling, let's give a big shout out to Mr. Jason Elliott, fellow TSPer, listener of the show, part of the LMP tribe. He's given us some really good feedback about the show, specifically constructive feedback about the sound volume. And over the past couple months with each episode, we've tried to make some adjustments to the sound quality, put some sound treatment in the rooms and, get things dialed in. And he's been giving us feedback about that. So big shout out to Mr. Jason Elliott. Thanks so much for the feedback. And how was Thanksgiving, dude?
I actually did Friendsgiving this year.
Oh, really?
Mm-hmm. And I loved it. It was low stress, no stress. And I cooked my own turkey and carved my own turkey. And we had some good protein post-gym. We did 2 workouts in the gym for Thanksgiving, me and my buddy.
On the same day?
Yeah.
You did a
morning and evening
what was that
workout?
called back in the day?
2 days.
Twice a day?
Yeah,
2
2
days.
days.
Yeah.
It was
awesome.
awesome.
Wow.
And I'm starting to get fit.
What percentage of people do you think went to the gym on Thanksgiving? How awesome is that, dude?
You know how many people are going to go on fucking January 1st?
All of them.
Everybody. That's the worst.
How many people are going to still be there on February 1st?
Dude, that's the worst week or month for normal, year-long gym goers. Everyone hates it, and you might as well take a leave of absence for January. It's just packed with people that don't want to be there.
Well, lately I've been thinking about getting back into the gym, doing more the dumbbells, barbells, stuff like that. I'm more of a get out in nature type of guy, but I've been feeling the call. Yeah, that's my meditation time. Do you do anything outdoors or just everything?
I just went on a walk tonight to try and clear my head, and I gotta tell you, it made things worse, not better.
Oh God. You need to do a walking beer bong or something like that.
Maybe I should go talk to a pharmacist, which we got Jason M here tonight to help us out.
Let's get rolling. Jason, welcome to the show. How are you?
I'm doing good, man. Thanks for inviting me to the show.
Oh man, it's a pleasure. It's an honor. Why don't we get rolling? Let's go back a little bit though until we get before we get into your background and professional role in pharmacy. Let's go back to high school. When you were graduating back in the day, what were you thinking about doing?
Oh man, way back in the day. That's what late '90s right there, man.
Oh wow.
After we graduated high school in '99, I was trying to figure. I thought about med school, but didn't really think I could do it. It wasn't until I was 21, 22. That's when I thought about doing pharmacy school. But I thought about doing pharmacy school mostly for the wrong reason, honestly. But glad I did it. And the story that I was telling you earlier about pharmacy school, whenever I thought about pharmacy school, I had no idea what a pharmacist did, no idea what a pharmacy was. All I knew was that they made a good living, and that's what drew me to it. And I think I had to shadow a pharmacist for a few hours in order to get into pharmacy school. And to kind of like paraphrase or the old Seinfeld joke, all I did was to see a little old lady take the medication from the big bottle and put it into a little bottle, and thought I could do that easily. And thought that was just like a great living right there. And somehow I weaseled my way into pharmacy school, and that's when I really realized like what a pharmacist really did. It wasn't just doing what Seinfeld said, big bottle to little bottle, but it was so much more. So I think that's what we're kind of here to talk about. Is kind of like the general idea of what a pharmacist does and all the different types of pharmacists, including what I do specifically as a clinical hospital pharmacist, as opposed to like my retail brethren that work at like CVS, Walgreens, HEB, the compounding pharmacists, the clinical specialists that deal with like infectious disease and whatnot. So I guess to give you a general idea. So what would you guys like me to
No,
say
that's
and
great. That
whatnot?
I mean, that you said it perfectly. I think at least 95% of people have that same vision in mind when they think of a pharmacist. It's just someone that takes, medications from one bottle and counts them out and puts them in another bottle and hands them to the patient or the customer. As we kind of chatted about earlier, I went to a graduate program. I studied medicine. I went to a graduate program with a pharmacy school in there as well. And we kind of, there's a little mingling and whatnot with the program. And I know they took like biochemistry and coursework, and they did clinical rotations and all. But but even folks in healthcare, like I don't know that we really have a strong idea what pharmacists do, how they're trained, the different roles. Like you said, they go into retail pharmacy, clinical education, compounding, and so on. So, we, like you said, we wanted to give people a sort of behind the scenes peek into, how they're trained, the roles, and some tips for folks, some suggestions of how we can really maximize as patients, as customers, how can we maximize our interactions with pharmacists? How can we maximize our interactions with pharmacists if we're prescribers, whether NP, physician, PA, so on. So yeah, you really hit it. Maybe we could start out with training. You mentioned, the training. What exactly did that look like?
Yeah. So before you get into pharmacy school, like you'll have to do like about 2 to 3 years of prereqs. A lot of pharmacists now they're actually getting accepted to pharmacy school with a bachelor's degree already, which also like just makes it look better if you're trying to apply. And then it's about 4 years of pharmacy school. On the first 3 years is just pretty much didactic schoolwork, and your last year is when you start to go on clinical rotations. And after you get done with uh, after you get your PharmD, then you have the option of either going to work at a retail pharmacy or a compounding place or nuclear med or something like that, or you can do a or work into a hospital also, and then or you can go to a residency program to get further specialized if you want to do like just in regular internal med, which is a PGY1. Well, it'll kind of give you like, and it's pretty much an extension of your 4th year, where a lot more in detail about certain disease states since you're very expected to know a lot of stuff already, and then you can further go into a PGY2, which you can specialize in critical care, infectious disease, hemonc, psych, and whatnot. Then after you get done with your residency program, you can look for a position as a clinical pharmacist. But you don't necessarily always have to do a residency, a PGY1 or a PGY2, which stands for postgraduate year one, postgraduate year two. You can do what I did and go the non-traditional route and just gain a lot of experience and just keep reading, um, and get a clinical position that way. But I always tell the residents or just tell students that if you want to get a clinical position, it'll be a lot easier if you do a residency program. If not, you might have to take a long route like what I did to get to a position I am now.
That well,
So
one. So you're talking about like residencies. It makes me think. Um, at least with my physician surgeon colleagues, um, they seem to go into they have to go to residency, and
Yeah.
they like to go into the more narrow specialties like orthopedics, uh, ear, nose, and throat, and stuff like that. Do you find pharmacists in general feel like they need to do those real narrow specialties like hematology, oncology, or critical care, or do majority of them stick to the more they get their PharmD, then they go to work? I guess it's more
It
of a
it kind of
curiosity question, but so
it kind of depends. If somebody just wants to just start working right away, they can go towards the hospital route. They're just working at the hospital. I just work in the hospital, just doing order entry. And when you go to hospital route, each order entry place could could be like a hybrid where you do like a little bit of clinical and order entry at the same time. Where it's not going to be purely clinical, but it'll give you a touch of it. And if for the ones that just want to go straight to retail, they can do that without doing residency. But in order to do like for the ones that are really gun ho about doing clinical, um, and utilizing a lot of clinical knowledge and whatnot, then those are the ones that do the residency program. And if they want to specialize, like what you were saying in like infectious disease, and critical care and internal medicine, stuff like that, then you can do like a PGY too and get really in depth in that particular specialty. And those are like the PGY two programs. There's not as many, so those tend to be sometimes harder to get into those programs. But it's the ones that I work with. It's a worthwhile residency program.
okay. The hmm. I think where I went to school, they had some sort of like educational pharmacy. They had a lot of folks in
Yeah,
postgraduate year one. I always saw that
yeah,
PGY1 around. Um,
but I guess you can say like it's not doing a residency program. It's not really necessary, but
mhm.
it's really encouraged all throughout pharmacy, and it seems like more and more people are applying for like a residency program each year. It seems like.
Does that affect how? I think the easy thing is like having that residency under your belt helps you be more marketable when you're looking for jobs. But does it affect? Do you think it affects salary
It, uh, I'm not sure. Well, I definitely like if you go to retail, you're gonna get paid a lot more. That. There's no question about that.
in retail?
But if you go to
Oh,
retail,
okay.
you're gonna definitely get a lot more money as opposed to doing a clinical position or a hospital. But I'll tell you this though, sometimes money is not always worth it. Like me personally, I don't have the patience to deal with to work retail. Like I'm more suited for a hospital job or a clinical job.
Maybe
Uh,
you could maybe a good place to start would be tell us that
yeah.
analogy. I thought I thought it was brilliant. The analogy that
Oh
you
yeah,
gave
yeah,
me
for
a
sure.
little while ago about where how you see a pharmacist fits into the healthcare sort of team
Yeah,
approach. I thought it was a great analogy.
yeah, for sure. So like what I was telling Mike was the best way to look at what a pharmacist does, since we're kind of um, we're kind of like the forgotten part of the healthcare team, is like imagine a patient as a textbook. The doctor, nurse practitioner, or a PA is kind of like the author. They're writing the book, essentially writing the plan on how to take care of the patient. The nurses are kind of like the publishing house. They're printing up the books. They're enacting out the plan that the doctor or the provider is doing. The lab is kind of like the research and development. They're going out gathering information for the authors, for the doctors to write the book, to make the plan. And the pharmacist is kind of like the editor, the book editor, where they'll make sure everything looks good, as to help decide like the best cost-effective way to treat the patient without using the most expensive drugs, but help them out the patient in the most effective way. So that's the best way to describe what a pharmacist does. To describe what I do as a living is that I'm kind of just making sure that the patient gets the best care at the most affordable cost.
I love that analogy.
Yeah, I was just gonna say that's one of the best analogies I've heard about professions. I like that, the reading and the author part a lot.
Yeah, I appreciate it.
I got
Kind of.
a good one for you. So Jason, can you tell me? So I like this kind of behind the scenes stuff that always excites me. So when let's you know a little bit about the commercial side of it, right? Like the Walgreens stuff.
Oh yeah, yeah, yeah.
So can you tell me when they're back there and they're behind the counter and doing their pharmacist thing, what is it that they do for 8 or 10 or whatever hour shift? So like
Yeah.
what's
So
the
I'll try
secret
to give
there?
a breakdown. Like, it's been a while. I think the last time I did retail was about 2007, 2008, which is my last year in pharmacy school. So whenever a patient comes by, drops off their prescription, we'll enter it to make sure that, of course, we'll make sure that insurance approves it, but we'll also make sure that there's no drug interaction. We'll make sure that the dose looks appropriate, that it is written for the right indication. The frequency is correct as well, and then we'll talk to the patient if the patient has any question. We'll tell them about any possible, um, like the common side effects, the very common side effects. Kind of what to expect when taking this drug, when to take it, and if it upsets your stomach, tell them that it might be okay to take it with food, or don't take or take it on an empty stomach, or when is the appropriate time to take it. Like statins, cholesterol medications. A lot of times it's better. We'll tell them that it's better to take it at bedtime because that's when our body produces the most cholesterol. Or for like diuretics, we'll tell them, hey, be careful about taking this at bedtime. Take it in the morning so that way you don't have to wake up constantly in the middle of the night to go use the restroom.
Hmm.
The kind of stuff like that.
So you
So it's more definitely more than just putting medications into a bottle. I mean, there's a lot of thought into it, into what we do.
so you guys are back there doing science.
I guess kind of sort of. We're just making sure there's like no major drug interaction that can potentially hurt somebody,
Well, so
and
not
making sure
only
that the patient's going to get the right dose.
and you're so that ties in a couple of things. So not only are you all sort of screening, I guess you could say, the prescriptions as they come in, but I want to emphasize the things that you mentioned. Those are questions that people, patients, customers can go to the pharmacist and ask about if they're not clear. Like, let's see, you mentioned we can ask about drug interactions, take things with or without food, side effects, like what are the most common, what are the rare side effects, drug food interactions, what time of day might be the best to take it, check into dosage, is it appropriate for the illness or whatever the indication, how to take it. Those are all questions that people can come to the pharmacist. I really don't think people know that. Um, another thing I've heard you mention is people going to more than one pharmacy to get their medications. Can you kind of touch on that?
Yeah, for sure. That's polypharmacy. So polypharmacy, like I understand why some people like do that. They'll go to a CVS because they're offering like a coupon to save money on like some medication, whatever it is, and then they'll get a coupon from Walgreens that offers a nice discount on some other medication as well. I mean, I get people are just trying to save a few bucks here and there, but what makes it really difficult from a pharmacist perspective is that if somebody practices and does polypharmacy, we're not going to always the pharmacist is never going to know what exactly you're on at all times. Um,
Hmm.
so, like, say for instance, like somebody goes to like say CVS, they're on a drug called Coumadin, right? And then they get sick. Their doctor prescribes them like some antibiotic to take, like Levaquin, whatever. And one pharmacist is not going to know that, hey, the Levaquin and the Coumadin can have a really big drug interaction, where it's going to make the level of the Coumadin like go sky high, and then somebody can come in with like a really elevated INR and then hurt themselves and bleed really bad, something along that line. Or another example could be like Dr. A can prescribe like one beta blocker, and then Dr. B prescribes a different beta blocker, and the pharmacist won't know that the patients are duplicate medications, and that could like save a patient like a lot of money if they don't need to be on like two different ones. They can just increase the dose of one drug and get rid of the other one. And that's one way that pharmacists can kind of help out. If a patient just goes to one pharmacy, we'll know exactly what's on their profile at all times, and it'll just help out the patient, the provider, and the pharmacist.
I think so for anyone that doesn't know what a beta blocker is, that's just a heart medication or a medication that affects the heart, keeps the heart rate down, lowers blood pressure. So it's for folks that have hypertension. I think along with that idea that you want to get all your medications from the same pharmacy, so that pharmacist, that team can kind of do a little bit of an audit, making, see if there's any drug interaction, so on. I think when you start adding in controlled medications, which is, any of the medications where they're scheduled or they're controlled medications, like that's even more important to have all those medications in the same place. So, the people working at the pharmacy can hopefully catch if there's any concerning drug-to-drug interactions. Like, when we were chatting earlier, I mentioned some of the, let's say someone's taking a medication for seizures or for, real extreme anxiety, like one of the, what they call benzodiazepine, one of the benzos, like your Valium, your Xanax, or something like that. And, a patient is taking a medication like that, they're getting it from one pharmacy, and then they go to another pharmacy to get a medication that, maybe makes them drowsy, or multiple medications that can make them drowsy. And so you have a medication like a Xanax or a Valium or something that can make people drowsy, and you got other meds that make people drowsy, and you take them both. And I mean, it's just, that could be a recipe. Yeah, and certainly don't want to drive like that. But that's a big concern that immediately popped out to me, is you don't have that team kind of going back over your medications to be like, oh gosh, this will make you drowsy, that'll make you drowsy. You probably don't want to, take them both at the same time, or maybe there's another option. That was a big thing that jumped out at me. Yeah, speaking of medication audits, when I was going through the graduate training, the pharmacy students, the folks in the program would do, I think they called it an audit, like a medication audit. And I thought, wow, that's fascinating. Like you can bring in your med list and they'll look it over and be like, okay, that's redundant. This one, there's actually a less expensive version, and so on and so forth. Can you tell us about medication audits?
Yeah. Like I typically call it like home med reconciliations, and exactly what you said. I've seen it on several occasions where I'll look at a patient's home meds, and I'll see them on like I guess like a Zestril and a Vasotec, which are like two blood pressure medications that are categorized like as ACE inhibitors. And I'll ask them like, hey, why are you taking these two meds? And I think I had one guy that was just adamant, just arguing with me about that's the way he takes it. And I told him, like, but the best way for me to change their mind is by talking about their pocketbook. Like if you can just use one medication, increase the dose of that one, and get rid of the other one, and you'll save yourself a lot of money that way. And sometimes that's just the best way to change somebody's mind, is talk about money and how much money they can save. And it'll just be one less medication for them to take as well, which is also a nice little convenient thing. And we try to do our best. I mean, I think in the hospital we have like the ER pharmacists that will go through try and get as many talk to as many patients as possible at their home meds, make sure that everything's correct, so that way whenever they do get discharged from the hospital, that they're not going to be on duplicate meds. Or they're not going to be on medications that they stopped taking already, or they're not going to be initiated on a medication that they've stopped. Like a lot of times, antibiotics that get resumed in a hospital that the patient has stopped already. And not only that, I think, depending on which hospital you do, like you can get like floor pharmacists that will go and get involved with the home med reconciliation It can be tedious. It can be very time consuming, but it's a worthwhile thing to get as many people involved about their home meds. Make sure everything is correct, just so that way it can prevent any drug interaction, like what I've been harping on, and also just preventing like duplications of medications and just stopping medications that don't need to be on it. The patient doesn't need to be on certain medications to not be on it anymore.
So you called that a home medication reconciliation?
Yeah, home med reconciliation.
Okay. Is that something a retail pharmacy could do, or is that only in the
Oh
hospital?
yeah.
Yeah.
Oh no,
Okay.
anybody can do it. Honestly,
Okay. Okay.
hospital can do it. Retail pharmacy can do it. Like say for instance, like for a retail brand. I mean, again, I haven't been in a retail pharmacy in almost 8, 10 years. I guess 9 years now. But they can definitely go to the profile and just make sure that there's no duplicate medications. And the computer systems that we have in the retail, like it'll flag us if there's a duplicate medication, just like it'll flag me if I work in the hospital.
Very cool. And you mentioned some terminology earlier, ambulatory care. Um, are those folks, do they only do home med reconciliation, or is that
Oh
something
no,
else?
like the ambulatory care or AmCare, what we like to call it in short, like they'll deal with. They work very closely with a physician, and they'll help completely manage the patient's diabetes, making sure that the blood sugar is within range. They'll help manage blood pressure meds. They'll help manage like cholesterol, and they'll even manage, even though it's slowly going away. I imagine it's slowly going away with the new novel oral anticoagulants. But they'll manage somebody's Coumadin and make sure that the INR is within range, and asthma clinics as well, and make a lot of tweaks. And for the most part, like a lot of doctors will just sign off on what the pharmacist recommends because that's what they're just specialized in just doing it every single day. And
That's
so they'll
really
also
cool.
take a look at home meds, but they'll manage a lot of like your common disease states.
That's pretty cool because I know quite a few prescribers. They don't they want to come up with a plan and they want to come up with these are the meds, but they don't necessarily want to continue managing or make the tweaks necessary for some of the medications. So it's good to know we've got another professional we can go to kind of help fine tune those medications. Um, you told me about something that's really interesting that I've always wondered about. Say a patient gets a prescription and they get these giant horse pills or really big pills or whatever, and they're like, man, I just cannot take this. What's an option at that point when a patient cannot take a certain medication for whatever reason?
Yeah, that's whenever like a patient can take a certain medication for whatever reason,
Yeah.
they can go to a compounding pharmacy, and if the compounding pharmacy has a recipe or a formula, and that formula is able to be absorbed through the body correctly or appropriately, they can like change the route. Like say, like a lot of times, like compounding pharmacies, they deal with hormones, or they'll buy a bulk powder form of like estrogen or something like that, and then they'll put into a lotion instead of the patient swallowing the tablet. If they're having a hard time, they can just rub the lotion or cream on their skin at their wrist or something like that, and they'll get absorbed that way. And I think I was telling you about the funny story of a compounding pharmacy. What they were hired to go to a zoo and try and figure out, think outside the box and figure out how to apply like antibiotic eye drops to a gorilla because those going to be way too expensive to keep like to daily or not to daily but to constantly like sedate the gorilla to put the eye drops and then let it wake up again. So what they found out, or what the pharmacists came up with the idea was they just bought the antibiotic. I can't remember what it was. Bought it in bulk and diluted into like sterile water or whatever, and put it into a super soaker, and just every day for X amount of days, they just went to the zoo and sprayed that gorilla in the face with that antibiotic and aimed for the eyes to get rid of that eye infection. And I thought it was just like the funniest story ever about what a compounding pharmacist can do if they're allowed to think outside the box.
Oh, that is funny and creative too. Like in my mind, when I and I work in healthcare, I write prescriptions, I see patients, and to me, like a compound pharmacy is, they just take some medication, they kind of mash it up and mix it with another, something like that. I don't. So to hear that, it's fascinating. Um, Tell us about the lollipop and the chicken flavored lollipop. I think you said.
Yeah, I remember as a student, I was goofing around, and we could do like as part of compounding, we could like make lollipops where a kid, like hypothetically, like a kid is having a hard time, refuses to take a medication for whatever reason. We can make it into a lollipop form, and the kid can take the medication that way. Granted, it is going to be a lot more expensive because we're changing the route of the drug. We're actually making it individually and specializing for like one particular patient. But you could like put a medication into a lollipop, and then like add whatever flavor it is. And then what I was telling you earlier, like you could also like make grilled chicken flavored stuff for like a pet that might be having a hard time like taking a certain medication, because most medications most antibiotics, they taste like garbage.
Yeah, totally. That I mean, when that's so cool. I mean, it makes me think of my pediatrics rotation where, I mean, so many kiddos they just can't swallow the medication or whatever. So to have that option, oh man, I wish I would have known about that. That's so cool. Um, so maybe we could do a recap. So the neat takeaways for me are, or suggestions, I should say, that are takeaways. Get your medications from the same pharmacy. That way, the pharmacist, the team is better able to sort of catch different things, drug interactions, and so on. Um, it might be interesting, especially if a patient is someone is taking a lot of medications. It might be interesting, beneficial to the pocketbook to get a home med reconciliation. Get someone to audit the medications. Um,
Yeah.
Also, we talked about maybe the pharmacist knows less expensive options, like maybe something that a patient was prescribed is brand name, but there's a generic option available that's super inexpensive.
Oh yeah,
That might be another
that's
thing.
another great point that you brought up. Whenever it comes to like brand and generic, I always go with generic if possible. The reason being is that generics work just as fine. They work just as fine as the brand name, and they're a lot cheaper. They're a lot cheaper to buy. And again, it's just like like with generics, they've been tested to make sure that they work just as effective as a brand name. So don't get into, I guess, hopefully patients don't think of like brand and generic when it comes to like food. Like yeah, with food, there's a big difference between like buying the brand name versus the generic. But when it comes to medication, there's not a big difference. And I always recommend to my friends and family, buy generic whenever possible. It'll save you money, and it works just the same.
Yeah, actually, you know what, that makes me think of something. I remember my primary care provider back in the day. I think he was prescribing me antibiotics. I was ill, and he told me not to get this one specific antibiotic. I don't remember what it was because he was like, "Oh, that's manufactured in China. Like you don't want to get that one." Is there do, are some of these medications manufactured in another country? And if so, do you think there's any concern for that?
Oh, actually, yeah, a lot of drugs are manufactured in like various parts of the world. But the thing is, like the FDA regulates on like which generic company is okay. Just because they make it in one place doesn't mean that it's going to get immediately approved in the United States. The drug manufacturer is going to be the FDA is going to look at it and really make sure that it is like the medication is safe and effective, and it's equal to the brand name as well. It's kind of like I think with propofol at one point. Propofol, which is a local anesthetic, which is great, quick on, quick off. It was
Hmm.
on national back order. That's actually the same drug that Michael Jackson abused and killed himself.
Yeah.
Honestly. It was on back order. And so whenever it went on back order, like the FDA started looking at other like countries that were producing a drug, and they wouldn't approve it just yet. They had to make sure that those manufacturers that were like I think one of them might have been in China, whatever. We had to make sure that we had to test it, make sure that everything was exactly what they said it was before we would allow it to be used in the United States. So that's a really good question that you brought up. That just because somebody makes a destination doesn't mean it's going to be automatically approved for the United States. We will test and make sure it is okay.
Well, that's good to know. Like I said, he made a big fuss about it. So going back to the recap, so the questions that patients can go to their retail pharmacist, and again, a retail pharmacist would be, someone working at Walgreens, CVS, Meijer, Kroger, Costco, Sam's, those big pharmacies that we think of. You can go to the pharmacist and ask about drug interactions. If someone's taking multiple drugs, is there any concern with, those drugs? Do they take the medication with or without food? What are the common side effects? What are the rare side effects that we need to be concerned about? Drug food interactions, maybe what time of day they could take the medication. Is the dosage appropriate? And how to take it? And I want to make a point. Those are all things that you can talk with the pharmacist about, but it's also stuff that your prescriber, whether it's a PA like me, or an NP, a physician, surgeon, those are all things that person should be going over too. But again, if you ever have questions, you can go to the pharmacist, your retail pharmacist, and ask them these questions. Do you have any other suggestions that maybe we didn't cover? Any other suggestions for patients, for folks?
No, that's it. I think it's pretty much like if you have a question, like feel free to go to like your local pharmacy wherever you get your medication from, because they're pretty accessible. You don't have to make an appointment to talk to a pharmacist. You can just go up to the counter and just ask them a question right away, or just call. If you have a question, you can just call the pharmacy, and they'll like try their best to answer any questions that might be presented to them. And again, just to reiterate, just rehash it again, just if you're going to go to a pharmacy, just go to one pharmacy, so that way that particular pharmacist will know what's exactly on your medication profile to help you out a little bit better. Instead, if you were to go to multiple pharmacies, it'd be hard to keep track of everything.
That's great. I mean, you're sharing a lot of things that even though I'm in healthcare, I haven't thought of them or haven't learned about them. These are great suggestions. So maybe now would be a good time to move on to our Liberty questions, as we call them, which are the questions that we ask all of our guests. So maybe tell us, what do you see as a big concern that has an impact on your liberty, your freedom, your lifestyle?
Oh man, I'm pretty easygoing. I just take life as it goes. Like that, I don't know. I really don't know how to answer that. Well, I'm just going. I'm just like water, man. I'm just going with the flow.
Be like water, or whatever.
Everyone, you know what? I think some of these are really open-ended, and I kind of like that all of our different guests kind of have a wildly different take on them, different answers. I like that a lot.
So we're not worried, Jason. We're not worried about zombies marching or North Korea.
When it happens, it'll happen, and I'll cross the bridge.
That's a great answer too.
So when life is, speaking of that sort of thing, so when life is challenging, I call them character building days. What do you do to bring about mental relaxation or insight or clarity?
And I'm going to sound like a huge hypocrite because I think whenever we were talking about patient care, how like 50% of it is like what the doctors, nurses, and pharmacists want you to do, and the other 50% is acting out that plan. Oh, I'll tell you this: whenever I have a really bad day, I just go out, drink a few beers, and cook up a nice juicy fat steak, which is terrible. This is one of my nice coping mechanism on bad days.
I love that. Sounds freaking awesome right now.
It's gonna do as I say, not as I do.
So many healthcare folks. So a mentor once told me, start every day happy. So how do you start your day happy?
with a big cup of coffee to get through the day.
Or a pot.
Or a pot.
So, do you put like grass-fed butter or anything like that in it? Just black?
No, I just like some artificial sweetener, even though that's kind of frowned upon, and just a whole bunch of half and half.
Me too.
And then I just plug through and just go through the motion of my day.
To get warmed up, huh?
Yeah. And then last Liberty question. Do you have any recommended, I don't know, reading or YouTubing or podcasting for things that we kind of touched on, or for self-empowerment, liberty in general?
Oh man, most of the time whenever I read it's like I just read journal articles constantly. Just go to a coffee shop and just sit down and read to stay updated. But if you want to like look at something funny, I don't know. I also just like watch BuzzFeed Tasty and look at their. Have you seen the video where they compare like what's like a $6 cup of coffee versus a $200 cup of coffee? Or
there's such a thing as a $200
like
cup of coffee?
What?
It is ridiculously crazy. I think the $200 cup of coffee is like some rodent eats it and then craps it out, and then they clean it up and then they sell it to rich people.
Oh yeah.
Cappy Luau, something like that.
That
something
sounds
like
about
that.
right.
Yeah, something like that.
It's in that movie
something
with
ridiculous. I don't know if I can ever eat or drink coffee that some animal just crapped out.
Well, the animal, it's some sort of like cat-looking thing. I know I've seen a picture of them.
Yeah.
And it eats I think they call it a cherry, the raw thing that the coffee bean is in. It eats that, and the digestive system strips all the flesh, the green flesh off, and then it just poops out the coffee bean, and then they kind of like wash it. Yeah.
It's supposed to be really good. Supposedly it's supposed to be really good.
You know what? I think I'll pass.
Yeah, I think I'll pass on that one too.
I'm looking online. It says $350 for a 1 pound bag.
Wow.
And then the one right next to it says $2,000 for, I don't know how much is in there, but there's a certificate that comes with it.
I'm gonna go find.
So I'm gonna animal's face that pooped it out.
Do what?
I guess it shows the picture of the animal that poops it out. That's the specific one.
Civet cat. Civet.
Civet.
Kivet.
I'm gonna.
I don't know. Cat poop coffee.
Maybe I'll go feed some raw coffee cherries to like the local possum or raccoon and start.
Maybe you'll stumble onto something bigger and better than that. Yeah. Cheaper.
$200 a pound. For the nerds out there that want to know what journals you're looking at, do you have any suggestions there?
Yeah, the ones I like to look at a lot is I like to look at the IDSA guidelines, which is the Infectious Disease Society of America guidelines. Is trying to keep updated, but like the soft skin tissue infections, the community-acquired pneumonias. I sound like a huge nerd when I say this, in like hospital-acquired pneumonias, ventilator-acquired pneumonia, stuff like that, as well as like AFib, CHF, JNC8, stuff like that. Just to keep updated, honestly. Make sure that I'm not falling behind.
Infectious Disease Society of America, is that what you said?
Yeah, IDSA.
Okay, IDSA. We'll put that in the show notes. And not really a question, but something I just thought of here right at the end. I have a suggestion. We're talking about medications. For all the patients out there, all the folks out there, whether they're your medications or maybe you got a loved one, keep a list or something, or memorize them at least. Keep a list of the medications that you're taking. I'd say probably even how long you've been taking it. Any side effects.
That's a really great idea.
Yeah, dosage. What medication are you taking, and what's the dosage? I mean, I'm sure if you had $1, like I did, for every time someone was like, I don't remember what it is, but it's like a little white tab with the score mark, and I'm like, that doesn't help me. So
it doesn't help anything. Yeah. But actually, that's a great idea. And actually, I should have mentioned that. If you're on medications, definitely keep a list on you, a paper list, a list on your phone, and don't just keep it on your phone. Like, give it to a loved one as well. So in the event that you're like in some tragic accident or something hits you really hard where you're not able to talk and communicate, at least somebody will be able to like show you an updated list of medications that you're on. So that way it'll help the doctors pinpoint is it the medication's fault? Is that why you're in the hospital, or or is that medication making something worse? Like say for instance, if you're on like some type of blood thinner and you're having like a GI bleed, then we'll definitely know to that hey maybe that blood thinner was the reason why you're bleeding to death now, and we'll just have to hold it and stop it and figure out something else for the time being. But yeah, great suggestion right there, Mike, about having a list of medication and also to just keep it updated every time there's a change. Update it and cross out the medications you're no longer taking, and update the ones that you are taking. Good idea. Real great idea, actually.
Yeah. So the medication, and then you want to know the dosage. Um,
Oh yeah,
yeah.
name of the drug, the dose, how often you're taking it,
Mhm.
and then if it's like antibiotic, like when did you start it and how long you're supposed to be on it. So that way, whenever you do get admitted to a hospital, they can discontinue it for X amount of days and let it stop on its own. Or I figured that might be part of the reason why you're in the hospital for whatever reason.
Well, we certainly appreciate you taking time out of your day to give us sort of a behind the scenes look into pharmacy and give us some, I mean, really good suggestions. Again, I mean, I work in healthcare, and some of the things that you told us about, ambulatory care, compounding pharmacy, the analogy that you gave us, I mean, those are really valuable. So I certainly appreciate you taking the time to share some ideas with us. So thank you very much.
Hey, not a problem, man. I appreciate being a guest on this show.
We hope to have you back. If any new stuff, anything interesting, man, you're welcome back. Thank you.
Hey, appreciate it. Hey, thank you guys. You guys have a great day.
You too, man. See you next time. Thanks.
All right. So if you found some value in today's episode, if you stuck with us and gathered some pearls from Dr. Jason M., please share the episode with your friends, your family, anybody who might want to save some money using the tips we talked about and just have a better understanding of pharmacy and medications. Share it with them. You can also keep up with everything we're doing by going to the website, libertymastermindpodcast.com, subscribing to what we're doing by email. You can find us on Facebook. Where else are we? Twitter at the Liberty 3, like the number 3. You can find Pat Leo on Instagram. Pat, what's your handle?
On Instagram, I am Uncensored Tactical.
Yeah. Where else are we? We're trying to take over. Where else are we, guys?
We got most of the podcast platforms. YouTube will host our podcast. We have it on our website at libertymastermindpodcast.com. Really long title. We'll try and shorten. We'll try and give you a bookmark shortened for the future.
And one thing that you can do to help us out is if you are listening on iTunes, go through your podcasting app, find the show in iTunes. You can search Liberty Mastermind Podcast, will pop up. Go in there and please rate and review the show. So rate is the star rating, and then review is just type up what you think about the show, what you like about the show. So please rate and review the show through the iTunes podcast app. That'll help build up the brand and build up the what would you call that?
Some viewers, audience.
Yeah, that'll kind of expand the message. Yeah. So please help out the show, help out the tribe. Let's reach out and serve more people. I told you, I like how, at least during the bonus of the episode with Jack, where you guys were still talking, but the outro music kicked in.
Yeah.
I don't know, that was kind of cool how that, like it wasn't, you guys were like, hey, all right, bye, and then the outro music was you guys were still rolling. So it kind of leaves the audience like, oh, like they're still hanging on. You know what I mean?
That's
I like that.
You know, yeah. I thought I'd try. Podcasting is taking podcasting and just regular internet news from regular people is completely destroying the mainstream media today, which I love. Yeah, but that's an old school kind of radio show tactic. Like music starts and you're like, oh man, it's gonna end soon. You're like, oh, let me get you these last few details and a shout out to mom and dad and So we threw that in there. We figured we'd try something different, which is probably what we'll do today.
Oh, dude, it was awesome. I was just like, oh, like I don't know, it just keeps everybody hooked.